My name is Sarita Wilkins, and I am the Communications Strategist for the National Resource Center for Refugees, Immigrants, and Migrants. And I wanted to thank you for joining us today on this webinar. So first, I'm going to give you a little bit of background about NRC RIM and go over some of the resources that we have to offer that support vaccine confidence in refugee, immigrant, and migrant communities. Then I'm going to hand it off to my colleagues at the International Rescue Committee, who are going to offer strategies for discussing COVID-19 vaccines with clients. NRC RIM is funded by the CDC, and we're housed at the University of Minnesota. We support both health departments and community-based organizations working with refugees, immigrants, and migrants. We offer health education in the form of videos and translated resources. We have toolkits on COVID-19 testing, contact tracing, and strategies for communications and community engagement. We have on-demand training as well as webinars like this one. And we have several resources available to support vaccine planning, rollout, knowledge, and confidence among refugee, immigrant, and migrant communities in our Vaccine Central. We also have in here, we have checklists and guides that support your vaccination efforts, as well as promising practices from around the country that you can replicate in your own community. We have 3 campaigns. We have Get Vaccinated, Get the Facts, and Vaccination Is, all of which include translations and customizable templates so you can use your organization's logo or even swap out the photos. To learn more about our campaigns, we have an upcoming webinar that is May 27th, and then we will be repeating that again on June 10th. Now I wanted to introduce our panelists today, Sarah, Lena, and Daniel. Sarah Clark is the technical advisor for health promotion with the International Rescue Committee. She's a global health consultant who's worked with organizations in the United States, the Netherlands, the United Kingdom, Canada, and Mali. Sarah is also the coordinator for the Society of Refugee Healthcare Providers and co-organizer of the U.S. North American Refugee Health Conference. Her most recent work includes program manager for a team investing COVID-19 outbreaks in Southern Alberta's meat packing plants through the University of Calgary's Refugee Health Research Program, Refugee Health YYC. Sarah has a Master of Science in Public Health from Johns Hopkins Bloomberg School of Public Health and a certificate in Global Mental Health, Trauma and Recovery from the Harvard Program in Refugee Trauma. Lena Zara is a Project and Operations Senior Coordinator with the IRC. Lena is a Syrian-American social impact partnership strategist and a bridge builder. She has a master's in international development and humanitarian emergencies from the London School of Economics and Political Science, with a specialization in highlighting issues and shifting the narrative for globally displaced persons uprooted due to humanitarian crises. She has worked with small to large scale nonprofits, NGOs, social justice coalitions, and government agencies like the World Food Programme, International Rescue Committee UK, Karim Foundation, and the US Senate. Daniel Kaingo is a licensed social worker in the state of New Jersey. He graduated from the State University of New Jersey with a master's in social work and is also holder of an undergraduate degree in English literature from Pwani University in Kenya. He also holds a certificate in promoting child and adolescent well-being from Rutgers University. With more than 2 years of experience working in a variety of settings and with diverse clients, Daniel is currently working as a community health worker with the IRC Elizabeth office, specifically with the Congolese Swahili refugee community to address vaccine hesitancy, identify barriers to vaccine access, and find ways to help the community at large with vaccination campaigns. Please join me in welcoming my colleagues from the International Rescue Committee.
Thank you, Sarita, for the introduction and for hosting us today, and a warm welcome to everyone on the webinar. I'll just give Lena a moment to get started. Thanks, Lena. Next slide, please. So here's our agenda for today. This webinar is intended for any client-facing staff, regardless of your specialty or your comfort level with health-related topics. Our goal is that by the end of this discussion, you'll feel better equipped to answer questions about the COVID vaccine in a way that fits within the scope of your role and also honors clients' autonomy. Next slide, please. We're hoping that you're feeling chatty today. We wanted to ask you to type into the chat a few words or just one word. How do you feel, honestly, when a client asks you a question about the COVID vaccine? Timid, grateful, happy, excited to share, excited they're asking. Oh, that's very good. Untrustworthy, hesitant, comfortable, challenged, hopeful, delicate, prepared but heavy responsibility. Yes, it can feel very heavy. Happy to help and discuss, don't want to push, excited, happy they're asking but hesitant to answer questions, happy they're interested, advocate, reserved. So it looks like there's a good range of emotions that you all are feeling when you're answering these questions. And we're hoping by the end of today that a lot more of you will be on the more excited end and comfortable end. Next slide, please, Lena. So everyone, including within the general population, has lots of questions about the COVID vaccine, and it's understandable that clients are asking us these questions when they meet with us. We've heard from our IRC staff that many are feeling unsure about how to respond because obviously the COVID vaccines are new. There hasn't been that much in-depth training on the vaccine. Health-related issues might be outside your normal scope of work. And the pandemic continues to be very dynamic with guidance and information changing sometimes daily. And even for those of us with public health backgrounds, it's difficult to keep up with the updates, such as, for example, the pause and unpause of the Johnson & Johnson vaccine, or the updated guidance about wearing masks, etc. Through NRC RIM, we've created this resource pictured, which is called Common Questions, Helpful Responses. It's been shared with you already, I think, in the pre-webinar email, and we can also put a link in the chat. It's designed to help client-facing staff confidently and competently respond to common vaccine questions. And it lives on the NRC RIM website that Sarita showed you earlier, meaning that we're keeping it updated as the COVID situation changes, so you don't have to keep apprised of all the updates on your own. So we encourage you to take a closer look, consider bookmarking this page so you have it handy when you're meeting with clients. And when you're responding to clients' questions, don't tweak the essential facts, but please feel free to adjust the words to better fit your tone and the way that you speak, as it's really important for you to feel authentic when you're talking with clients. Next slide, please. Before we talk about the techniques for how to respond to clients' vaccine questions, we wanted to remind you that it's important to keep in mind that refugees and other forcibly displaced people may have lived experience or a family history that includes medical experimentation or unethical medical practice or research. And this is also true for many people of color in the United States. And there are unfortunately many examples, one being pharmaceutical experimentation, especially in the global South. In addition to the Tuskegee experimentation, which was focused on African Americans beginning in 1932, the US has been sterilizing Native Americans and African Americans as recently as the late 1970s against their consent. And then for some of our Ukrainian client populations, there's a potential mistrust of the government itself due to experimentation on civilians. In addition to this, there are certain negative influencers who you may have seen on social media who are intentionally spreading incorrect information because they're trying to sow discord and distrust in a community. They know the information they're sharing is not true, and they are actively trying to spread it. Given this background, it's understandable that clients might be distrustful of the COVID vaccine. Next slide, please. No matter what our roles are when engaging with clients, in the context of the COVID vaccine, we can respond to their concerns compassionately and with the ultimate goal to equip them to seek out accurate information from credible sources. The emphasis throughout any conversation that you have can be reassuring clients, first and foremost, that asking questions and feeling hesitant is a normal, positive approach for them to take. It's good for them to question and to seek out information to make autonomous decisions. And then what's key to your role is being that person to point them to the factual information for them to make this decision. You can explain to clients that your role is not to tell them what to do, but to connect them with the accurate, trustworthy, scientific-based resources so that they can then make the decision for themselves and their families. If you don't have an answer to your question, to their question, that's also fine. And you can be honest and open with them and tell them you don't know the answer to that, but you're happy to find that information out for them and get back to them later with the answer. Next slide, please. In our guidance on the NRC RIM website, we list many resources you can point clients to, especially those that are already translated into key languages, and NRC RIM has many of those resources housed in their translated library. And you'll see in our role play conversation later that while discussing the vaccine with clients, we try not to repeat the myths that clients might hear, such as it can change your DNA or cause you not to have children, because that can inadvertently reinforce the myth in the client's mind. And you're careful not to tell clients the information that they have is wrong. Instead, we try to repeat the facts as we know them, and you can use our resource as guidance for the exact way to phrase it, and then just refer clients to further sources. Next slide, please. In addition to clients' vaccine concerns, you might hear concerns from community leaders. And community leaders, as you are probably very familiar with, can also have a significant influence on clients' vaccine beliefs. So I'm going to turn it over to Daniel, who's going to share more about his experience working with community leaders in New Jersey.
Hi, everyone, and thank you for joining us. This is an example from New Jersey Elizabeth office. I was working with primarily the Congolese Swahili community. So one of the things that we did was trying to see why there was vaccine hesitance among that community. So the first part of the engagement was identifying these leaders. Maybe you can ask, how did you identify them? So in our conversation with clients, we were able to determine that there are leaders within the communities who the client or the community at large look up to. And also we're able to identify churches where they go and the church leaders who are among the community. So after that, we set up a focus group to discuss. So the second part was discussing what actually the community is saying about the vaccine. What are they hearing on the ground? And some of the things that came across was that the vaccine is not safe because production was very quick. They were saying malaria, we've had typhoid, we've had cancer for so many years that are killing people, but we didn't have a vaccine. Why is it that there's COVID vaccine? The other thing that came up was like, why all of a sudden there's a COVID vaccine and there's so much interest about our communities, the refugee? Why is that? Is this vaccine out to harm us? So after gathering that kind of information, we went back again with the leaders and say, okay, so this is what is on the ground. How best can we help as an office, IRC? What is it that you want to hear? What information will you want to hear that would be helpful? And who do you want it to hear from? So they said, because of the misinformation that was going around, which was rampant, they would love to hear from professionals like doctors, people who have first-hand knowledge about the vaccine. So we were lucky enough to have engaging with a doctor who spoke their language, which was easier for them to trust the doctor. And we had a follow-up meeting where they sat with the doctors and all their questions were answered around the vaccine with the doctor. And it was helpful because after that, we saw that they had shifted a little bit from not wanting the vaccine to somehow I'll get it, and some say, okay, now I'm ready to get it. So the other thing was trying, because of the NRC RIM project, we had material that we wanted to share. So we needed to know what's the best way that this material can reach them. And so we identified the best channel, and to them, using WhatsApp was one of the best channel, and social media such as Facebook. And in our office in New Jersey, we also do have Callfire, whereby we just record a message in their language and it goes out to them. So that was the whole process of engaging these leaders. And at the end, now we are seeing that much of the hesitancy around vaccine has gone down. So we are hoping that all of it will go down and most of the community will get vaccinated. If you have any questions around what I've just presented, please feel free to put it on the chat. And from now, I'll turn it back to Sarah.
Thank you, Daniel, for that great example. And just to reiterate that some of your clients might be themselves community leaders. And so their questions, if they're coming to you with questions about the vaccine in particular, you might want to frame how you're responding to them in a certain way and see how you can get them materials that they can then share with their communities. And again, there are lots of resources on the NRC RIM website that are about how to engage with leaders, particularly. And also, as Daniel said, we're always happy to answer any questions. Next slide, please, Lena. Before we start our role play, we want to hear from you again. So if you don't mind, Lena, going to the next slide. So let's say you're meeting with a client who asks you, do you think I should get a COVID vaccine? I don't think I should. The CDC says we don't have to wear masks anymore. That means COVID is over, which is something we have heard from clients since the recent CDC guidance about masks. Next slide, please. So we're hoping you can type in the chat, and as a note, please send it so that it says in the message all panelists and all attendees so that everyone can read it. But we're wondering, normally, how would you have responded to this question in the past? Would you say, that's a good question, but I'm not the right person to answer this? Would you say you should still get the vaccine? Or that's a good question, I can share with you what I know from trusted sources. And it looks like everyone so far is saying C. And I don't see anyone who said differently. In the past, B and C. Yes, thank you for sharing that. So yes, depending on your role and depending on your comfort, in the past, you might have said A or B. In the end of this presentation, you'll see where we're hoping to help you feel equipped to be answering as C, where you're validating it's a good question and you're sharing with them the trusted sources, but not exactly giving an opinion, and also feeling equipped to be the right person, even if you're not clinically trained. Next slide, please. Daniel and Lena are going to role play a conversation now between a case manager and a client. We're going to pause a few times during the role play to review the techniques Daniel's using as he speaks with Lena, the client. And the beginning of the conversation is going to address these two questions on the slides. So while you listen to the role play, please type in the chat what concerns you might have in answering these questions.
Thank you for meeting with me today. Before we end our meeting, I want to take a few minutes to see if you have any questions about the vaccine. I know typically we don't talk about health together, but all our CKS managers at our office are taking a few minutes to just check in and see if you have any questions or concerns.
I do have questions about the vaccine. I'm not really sure if I need it. Do you think I should get the vaccine?
That is a really great question, and I'm so glad you asked. There's a lot of information going around, and it is very important to look at what is accurate and what is trusted in order to make your decision for you and maybe for your family too. So the vaccine will not only protect you, but will help protect your family and others. It's a personal choice. I did choose to get the vaccine, and here is why. I wanted to protect my family, myself, and people around me. And what I know is that when enough people get the vaccine, we'll be able to see our family and friends again. And the things we do will be more normal. Again, it is important that everyone make the decision that is best for themselves, their family, and the community after knowing all the facts. I can share some facts-based resources that might help you and your family make a decision. It is also important to know that people who are pregnant or have serious medical issues should first get the facts and then talk to their doctors about whether they will get the vaccine or not.
Thank you so much. I do have to say, I'm also very afraid of needles. I don't know how I could stand getting vaccinated, especially if I have to get more than one shot. What should I do?
That's a very valid concern, and you're not alone in being afraid of needles. It's a very common fear, and normally we get those kind of questions from people who are not comfortable with needles. However, there are many times throughout our lives where we need to get a vaccine or maybe give blood or donate blood, and we find ways to try to cope with the needles. In the past, when you've had a vaccine or give blood or maybe donate blood, how did you cope with being afraid?
So in the past, I'd have a family member come with me. I usually would tell the nurse that I was afraid too of needles, and she would help me by walking me through things, talking me through kind of what she was doing, and advise me to look away if that would also be helpful.
That's great to hear. Was it as bad as you thought it would be?
Um, I guess, yeah, I guess not. I just get so afraid ahead of time and that I get really stressed and anxious.
I get that. Another way that people who are afraid of needles have decided whether to get the vaccine or not is to think of what will happen if they get the COVID and they have complication and they end up in the hospital, and what are some of the needles and intervention from the hospital that they'll get. And in that way, some people have found that they are less afraid of getting the vaccines um, when thinking about the needles that they may need if they get really sick and end up in the hospital.
So you'll see that when he was answering these two questions, Daniel didn't say you should get the vaccine. Instead, he demonstrated his role as a trusted source to point people to the reputable resources. He shared his personal experience and he encouraged Lena to make the decision that's best for her and her family. He also let her know that having questions or concerns is normal. He practiced empathetic listening, especially with her fear of needles. And he just tried to help her work through comparing, what would it be like to get the shot versus to get COVID. Next slide, please. For the next part of the conversation, again, if you want to type in the chat how you would approach this question about, is the vaccine halal?
I have another question. So, is the vaccine truly halal? I don't know what the vaccine is made of. I've been hearing different things. I've heard it contains pork and other products. Can you help me answer this question?
Yeah, that's a very good question. Thank you for asking. We've had that question from many of our Muslim clients. I'm no expert by any means, but after consulting with my RC colleagues who are Muslim and know about Islam, this is what they reported, that the vaccine has been determined to be halal by many Islamic religious leaders and scholars, including the British Islamic Medical Association, the Assembly of Muslim Jurists of America, and the Grand Mufti of Saudi Arabia. So based on that, I would say it is halal.
So here, Daniel is building up trust and he's staying within his knowledge base. You'll notice he acknowledged that he's not an expert and he explains where he heard this information from and that it's from reputable sources, such as leading organizations in the Muslim community. Next slide, please. As Lena and Daniel continue their conversation, you can type in the chat what materials you maybe would want if you were being faced with these questions, which are a bit more specific about the vaccine and how it works and some of the myths about the vaccine.
I just don't think that the vaccine is safe. I've heard so many bad things about the vaccine and seen videos on Facebook of people having bad reactions. My neighbor says it can even change my DNA and make it so I can't have children. It can't be that safe if they've developed the vaccine so quickly, can it?
That's another great question, and thank you for asking. From what you're telling me, I can tell that you care a lot about your family and wanting to gather the right information so you can make the best decision. There's a lot of information around COVID vaccine. Some of it is factual and some of it is not true. But the most important thing for you is to go to sources that are reliable and that have been studied and they are proven scientific facts. This will allow you to get the information you need to make the best decision for you and your family. Sometimes it is also helpful to talk to someone who you trust and you know that has accurate information. For example, doctors or nurses or community health workers. Many of these professionals have already gotten the vaccine, so they can tell you about their experience. The vaccine was tested on tens of thousands of individuals from different ethnicities and ages, and it met US Food and Drug Administration high scientific standards for safety, effectiveness, and manufacturing. And since last year, December 2020 to March 2021, over 109 million doses of the vaccines have been administered within the US. Its safety has been closely monitored.
Okay. I also don't understand why I should get the vaccine. I heard that the CDC said we don't have to wear masks anymore. Doesn't that mean COVID is over?
Great, that's another good question, and we've had this question from many people, especially right now, and I know it can be confusing. The CDC has said that those who are fully vaccinated no longer need to wear face masks in most situations. However, there are times when masks are still required, as when, for example, traveling or you're in a healthcare setting. And again, each state and local businesses also decide on their own rules about masks. Since the research is still trying to determine how long vaccine will protect us and whether vaccinated people can spread COVID or not, for the sake of our loved ones and our neighbors, children who cannot be vaccinated, or people who, for some reason, health-wise cannot get vaccinated, wearing a mask, if it's possible, will help keep everyone safe. Also, if you have not been vaccinated, you still need to wear a face mask before. This is to protect yourself and others from COVID. COVID is still infecting thousands of people per day in the US, and many people are still dying. So in order to stop COVID, we need as many people as possible to get the vaccine. Again, the CDC is saying that only fully vaccinated people can go out without masks in certain situations. And by fully vaccinated people here, it means anyone who has gotten their second dose, whether it's the Moderna or Pfizer, 2 weeks. After 2 weeks, they're fully vaccinated, or the Johnson & Johnson, 2 weeks after you get it, then you're fully vaccinated. So in this case, we encourage all clients to get the facts about the vaccine and make a decision about themselves and their family. With these new guidelines about masks, maybe that's one more thing that you should consider when deciding whether you get vaccinated or not. In that, if you get vaccinated, then you have more flexibility in when to wear your mask versus if you don't get vaccinated and you have to continue wearing a mask.
It can be tricky countering misinformation without repeating the myth, such as if someone says, I've heard it changes my DNA or it makes it so you can't have children. But there are studies that have shown that repeating the misinformation, even if you're trying to say it's not true, that can actually increase the chance that a person remembers the myth as true. So you'll see that Daniel, when Lena was bringing up her concerns about such as the DNA, he doesn't tell her she's wrong and he doesn't say that that's not true. Instead, he tries to state the facts about the vaccine, and he tries to facilitate her self-learning by pointing her towards trusted scientific sources and sharing some facts and referring to the CDC as a trusted source while staying within his knowledge base as a non-clinician. Next slide, please. This is the last part of the role play. And again, it's been really great reading all your responses in the chat. So if you could keep typing, how would you respond to this particular question?
I'm really worried that there's a focus on refugees and immigrants because they're targeting us. Are they trying to test the vaccine on us? Could you tell me why everyone is just so interested in having refugees and immigrants get the vaccine?
I appreciate you sharing the concern with me. Institutions like the CDC are trying to give greater access and opportunity to support communities that face disproportionate barriers. And even though COVID had hit communities of color the hardest, including refugee and immigrants, the vast majority of the people who have gotten the vaccine are white. And here's the reason. There can be a lot of barriers to getting the vaccine. For instance, many times you have to sign up to get the vaccine on a computer and all the instructions are in English. Sometimes you have to print out and complete a form, which means you have to have access to a printer. Being able to take time off from work or having a car to get to a vaccine site can also be a barrier. So all these barriers can make it much harder for refugees and immigrants to get the vaccine. Did that address all your questions? I'm happy to follow up with the relevant resources in your language in any of the topics we talked about.
Thank you so much. Yes, I would definitely like to have some resources, please.
So again, Daniel was normalizing Lena's questions about the vaccine, and through his non-judgmental response, he was building trust where she could feel safe bringing such a concern to him. And then again, he's facilitating her own learning and decision-making by offering to provide her accessible materials in her preferred language. And I saw a question in the chat about what to do if your client maybe doesn't read, or if the scientific materials aren't the best way to give them information. That's exactly what NRC RIM has developed. They've developed many materials in different formats, such as audio clips that are public service announcements, so you can just listen to the information about the vaccine, or there are videos where you're watching about the vaccine with a voiceover, or there's written material that they can go through with a case manager. So NRC RIM is trying to account for all these different preferences for learning and then also have it accessible in many different languages. Oh, and I see Sarita has said 30+ languages. Next slide, please. So I wanted to review the key takeaways one more time, and then we wanted to leave plenty of time for Q&A because I'm sure there are lots of questions that have come up for you as you're meeting with clients. But to reiterate, your main role is to validate and reinforce by letting the client know that they have good questions and you're glad that they trusted you enough to ask you these questions. It's important to show that you're open to receiving these questions, even if you're feeling a little bit uncertain about answering them, and that asking these questions is very normal for clients to do. You can feel free to stay within your knowledge base and your role. Don't feel like you have to be a clinician and know all about COVID and how the vaccine works. And just emphasize with the client what you do know as a trusted conduit to further resources, and that you're always happy to get them more information if you can't answer a question they have. If you feel comfortable, it can be helpful to provide your own personal experience, such as if you received the vaccine and what side effects you experienced or why you decided to get the vaccine. Above all, it's about affirming clients' agency and choice, and that it is ultimately up to them to do what's best for themselves and their family. But in order to make the best, most informed decision, you want to make sure they have access to the latest scientifically based sources, because a lot of the information out there is not accurate. And then you can just make sure to indicate that you're happy to provide more information that's culturally and linguistically accessible. And many of these, as we've said, you can find on the NRC RIM website. And our team at NRC RIM and IRC, we're always happy to answer questions if you want to email us asking about a particular question or request that a client has. Next slide, please. I'm going to turn it back to you, Sarita, for the Q&A.
Thank you. That was a great presentation. We had quite a few questions come through in the chat. The first one is actually for Daniel. Veronica wanted to know if you got any input or collaboration from your local public health department in the initiative that the example that you gave at the very beginning.
Good question. The example that I gave, or whatever I did with the office, we didn't collaborate with the health department, but it was part of the NRC RIM project where we're trying to understand how the Congolese community are fearing their fear with the vaccine. So me as a community health worker in the office, I was able to gather information from clients, and I was able to identify the leaders in the community, and we took it from there and had a focus group with them, and they gave their concerns and they wanted to speak to someone who is a professional. So I followed up. I was able to get a doctor who speaks Swahili, and they sat down with the doctor and their answers, their questions were answered.
Thanks, Daniel. We had a lot of questions come in about reliable sources, so I'm going to go through them one by one, but anyone can answer, and some of the answers might overlap. But the first one here is, how do we help clients learn how to determine if a source is reliable or not?
It's a very good question, especially since we learned from our focus group discussions with clients and interviews that a lot of times, as with the general population, like a lot of us are receiving our information from social media, and it can be hard to say what's a trusted source or not. For clients in particular, I would give them some of the names of the trusted sources in the US, the main one being the CDC, and directing them to make sure that the information that's coming, that they're hearing and seeing, is legitimately linked back to the CDC website, and you could give them the URL. And explaining that a lot of times people will pretend to be speaking on behalf of an organization, but they're not actually representative of that organization. I would also direct them again to the NRC RIM website as a reputable source of information, and also a source that has lots of materials in their language. You could also share with them the local public health entities in your area, and such as even on social, a lot of them will have social media platforms, and you can point them towards those. Lena and Daniel, I don't know if you have anything to add.
I guess only just to quickly add to the point that it is common, and that's okay. And it's within that approach, it's also something that we've come across in discussions with various communities, is that also asking the community itself who they deem or perceive as someone as reputable or knowledgeable, because there's also that connection, that link that Sarah mentioned, that perhaps certain communities have more hesitancy where they've heard concerns, who they find as most influential. For some communities, it's health officials, sometimes it's religious leaders, and having those discussions also with, for example, religious leaders to indicate what those reputable, trusted, and vetted sources are also, I would say, kind of key components of being able to share the information from the CDC and the other sources that Sarah mentioned.
Thanks, Lena. And I'm seeing a few people saying in the chat about referring to their healthcare provider too. That's also a very good one that many clients have told us that's who they trust the most with questions, particularly about the COVID vaccine. And so particularly for your clients who might not be as digitally literate or have a harder time reading or finding materials online, you could definitely point them towards their doctor and help them come up with a list of questions they have ahead of time, and maybe even write them down or audio record them in their phone, so that once they get to their doctor, they remember what their questions were, because sometimes once they're at the appointment, they might get flustered, or we just forget all the questions we have. So that's one way you can help support them.
Thanks. We had a related question in the chat about how to encourage clients to look at other sources of information if the sources that they're already looking at are giving misinformation. And so what I've heard from your answers to the last questions is pointing them to the CDC or NRC RIM, their doctors, or other reliable sources of information. And I think that would apply here, but could you offer some strategies for how do you sort of delicately, honor their relationship with whoever they're hearing that from, while also encouraging them to seek other sources of information? If that question, I don't know if that question makes sense, but, how can you really assure them that their relationships with whoever they're hearing this from are valuable, but also it's helpful to seek other sources of information?
Mm-hmm. It comes back to, again, staying within your knowledge base and being comfortable with just repeating yourself over and over, and knowing that you're not a vaccine expert, and you don't want to jeopardize your relationship or rapport with your client. So you don't make it about those people at all that they're hearing it from. Like, they might be receiving it from family members, friends, reading it online. Instead, when you're responding to them and they say, oh, well, my friend shared this online, blah, 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 you can just go back to repeating the facts as you know it, and just emphasizing there's lots of information out there, some accurate, but a lot that's not accurate. What I do know is that the CDC and other scientifically based organizations have said XYZ, whatever it is that if they're saying like the vaccine isn't safe, that's when you repeat the answer we had about the vaccine has been used with 100 million Americans at this point. It's being very closely monitored. and talking about its safety record. And so all of those answers are in our on the web page that have a script. And I think that's what we want to emphasize is clients might keep asking you in different ways the same question, and you can feel comfortable just kind of repeating the same answer, but changing it a little bit. But where at the core, you're saying, yes, there's lots of information out there. Some of it's accurate, a lot is not. Let me point you to the correct information, and just don't even address the sources that they're getting it from.
Thanks, Sarah. Did anyone else have anything to add? If not, I can go to the next question.
I think just to, oh, sorry, Sarita, just to quickly add, along with that, because this idea of being sure not to damage any relationships, of course, not with your client, but also, as we mentioned in some of the scenarios, not to outwardly discredit or have the client feel that it's not okay to come forward with concerns, or we want to set the tone really and the atmosphere that it is a safe place to address these concerns, and not to discredit the clients, especially for having questions, but as Sarah mentioned, kind of guiding it into what you know to be the facts, because you also don't want to be put in a position where the client feels that you're also discrediting the potentially damaging the relationship that they have with those individuals that they've had, you know, engagements or relationships with a very long time.
Thanks, Lena. I'm going to invite, Ernestine has had their hand up for quite a while, so I'm going to invite them to ask their question. Okay, they might have hit that button by mistake. I'll go on to the next question that we received in the chat. So some clients have been expressing concern about the Johnson & Johnson's shot as being inferior or even dangerous, and that's why it's being reserved for minority populations. How would you recommend approaching discussions about that concern?
Lena or Daniel, do you want to take this one, or would you like me? I can do this one.
Do you want to do this one? Okay.
I would approach that by emphasizing again the safety record and how all the vaccines were created and the process that they had to go through to be created, and emphasizing that the Johnson & Johnson vaccine had to go through that same vetting and approval process. And then if they're worried, particularly if they're saying that because of the recent pause and then unpause because of the blood clots, you can explain to them, and again, this is on the webpage, so you don't have to memorize this response, but nearly 8 million people have received the Johnson & Johnson vaccine. And then there were only 15 known cases as of April 27th who reported the rare blood clot. So it was a very, very, very rare adverse event. And you can reassure clients that in the US, vaccine safety is a top priority. And so after reviewing all the available data, the CDC and the Food and Drug Administration recommended restarting the Johnson & Johnson vaccine because they've seen that the benefits that the J&J vaccine brings in keeping us and our loved ones safe far, far outweighs the rare side effect. And then you can also reassure them that the recommendation to pause and then restart the Johnson & Johnson vaccine, it shows that the national vaccine monitoring system is working. We had healthcare providers who were reporting the adverse events to the vaccine adverse event reporting system. And then individuals who received the vaccine were encouraged to report any symptoms they had to VSafe, which is CDC's after vaccination health checker. And so this is showing great transparency from the CDC and the FDA that they are reporting on what these very rare side effects are, and they took a moment to look at the data, and then they are moving forward. And so that increases our confidence in the process.
I'll also share that NRC RIM is actually working on a fact sheet about this specific issue. It should be available in English in the coming days, and it will be translated as well. We had another question. You had talked about, Sarah, letting people know how the vaccines are being made. And Lois wanted to know, how do you address the issue when people ask about the vaccine altering your DNA and the difference between, the mRNA and DNA, and just, how that all works?
Mm-hmm. This again comes down to knowing when to stay within your knowledge base and assuming that most of us who are answering these questions about how does the vaccine work, we're not clinicians. And so I would again approach it in a similar way when we've talked before about how do you address a question of it changes my DNA. First, by not repeating the myth, because as we've said, it can reinforce it in the person's mind. And just saying again that in terms of the myth and it changing DNA, there's lots of information out there. Most of it is not accurate. I can point you toward these trusted sources who will talk more about how the vaccine is made and how it works in your body versus focusing on the myth itself. Daniel and Lena, did you want to add anything?
Thanks, Sarah. How would you respond if somebody comes to you and says that they know several pregnant women that got the vaccine, their doctor recommended that they get the vaccine, and then they lost their babies, so now they're afraid to get it themselves?
So for that one, if they're saying that they've heard of friends who lost their babies, you can share with them the information from the CDC, which is that the CDC says that it's safe for pregnant women to receive the vaccine, and that you might want to they could have a conversation with their healthcare provider to help them decide whether to get vaccinated or not. And just, again, it's about, you are not a clinician, so you can't, and you don't know what happened with the friends, you don't know the situation. Unfortunately, with pregnancies, especially early on, there are lots of reasons why a pregnancy might be lost. And so it's not your job to say whether or not the pregnancy was lost due to the vaccine, but instead hearing their concerns, validating that they're worried because of what happened with their friends, reassuring them the CDC has said it's safe to use when you're pregnant, and they can talk with the best person to talk to is their healthcare provider to help them make this decision. I also wanted to go back, Sarita, if that's okay, to the previous person's question, because I realized there's a second part about explaining how it works in the body, which I can answer too. So again, we have this on the web page where you don't need to know the ins and outs, but just explaining to clients that the way the vaccines are working is that they're teaching your body to recognize and kill the virus that causes COVID. And that's why some people will have cold or flu-like symptoms for a day or two after getting the vaccine. And that this is just the body's way to recognize the virus and to activate the immune system to kill off the virus. And so once the body learns how to do this, it will remember. And then if you get infected with the virus again, your body is already primed to fight off and kill it. And then I wouldn't go into much more detail than that about mRNA and how it works unless you feel confident in your response. But instead, there are lots of resources on the NRC RIM website about how the COVID vaccines work from various sources in many different languages that a client could watch to get more information.
Thanks, Sarah. So we had a question that actually was submitted let's see here. We had a question about how would you answer, or how would you encourage young adult clients, say folks who are ages 16 to 21, or perhaps as low as age 12, now that Pfizer has been approved for younger teens, who are asking about the vaccine? And so specifically, this is about clients who they say that because they won't have severe or long-term consequences from COVID, they don't feel like the vaccine is as important to them for them to get.
Mm-hmm. I'll give my answer and then turn it over to Daniel and Lena, but two things. One is that we've heard from clients and offices that if you're trying to communicate with the 12 to 15 crowd, it's best to talk to the caregivers and target your messaging to the caregivers. And so the main messaging that they found to be effective is this idea that once your child gets vaccinated, they can go back to school. School will start to be more normal. And our offices were saying that lots of parents are very eager for that time to happen so that, their children are safely in school and then they can, resume life as it was before the pandemic, working and whatnot. So for the 12 to 15, again, we've heard it's best to target the caregivers and what's the benefit to them. Also emphasizing that the negative effects of getting COVID. Yes, it's true that younger people, it's much more rare, but a lot of our COVID, we call them COVID champions, our staff members who are bilingual, bicultural, who are really embedded in communities and hearing what communities think. They are advocating that it's time to shift the messaging when it comes to children and telling parents, it is very rare, but if your child, there are instances where children get sick from COVID and they have serious complications, and versus if you get the vaccine, your child is protected. Daniel and Lena, I don't know if you want to add.
Yeah, I think really you covered it quite well, Sarah. And I would think to add was one of that component of, to your first point, where it's this idea of what is at the forefront of kind of the daily life, the daily activities of youth, but just understanding how that is so connected to the family. Of course, never to generalize, but for various communities as well, the youth within the families have also taken on almost like adult roles in the families, being sometimes often becoming translators, having developed the language capabilities much faster, really being a support system for the family. So being able to understand the dynamics of the roles that family members have taken on, especially those that are of a younger age, and that connection to family, I think is just really critical to just kind of keep in mind, and in terms of how we approach this conversation with the youth and their caregivers. And another note to a little bit to what Sarah's saying on the second point is that also understanding the differences between these vaccinations and potentially other vaccinations you might get. Individuals have asked in the community, well, why is there kind of booster shots? Why are new things kind of continuously coming out? How does this impact the youth? And so just to bear in mind and understanding what those differences might be like, as opposed to, and also similarities really actually in that front with other vaccinations where you have that booster shot, I think is also critical just to keep in mind in this messaging, where it's not just what happens when you get the vaccination, but in the absence of, and its relationship or similarities and differences with other vaccinations. Daniel, I don't know if you have anything to add on, but that was what I wanted to be able to share as well.
Yeah, I think you guys covered it pretty well. What I also tell some of my younger, especially college-going kids, I just use the approach of protecting others, people that they love, protecting your grandma. So you just need get vaccinated so you protect the other people, because you might not be vaccinated and you might carry it around, because the chances that you can be a carrier and you don't know, and then you affect other people. And plus, there's some report now that the new variant has also been infecting mostly the young kids. So I try to encourage them to get the vaccine.
Thanks, everyone. We are out of time. The time just flew by for this webinar. So watch your email. I'll be sending an email right after this with links to all the information that we discussed, as well as a link to a survey, which we would really appreciate it if you could take. So thank you to my colleagues at the IRC, and thank you to the rest of you for joining us. Have a good day.
Thank you. Bye.
Thanks, everyone. Thank you.
Thank you, everyone.